Okay, everybody. Chris Nelson here, Dr. Chris Nelson, walking on the beach in Key Biscayne in between classes for a Seattle Study Club Symposium, and Dad's mic'd up right now too. So we're going to do a little walk and talk interview, and maybe for some of it, I'll turn the camera around so that you guys don't have to see me. But here's Dad. He's looking dapper. So yeah, I just wanted to go over today. Today's day 3, and the day 3 part of it was fun, although tiring. Again, we said that on every video, just because there's a lot to learn, and when you're learning, and
your mind is always engaged.
Yeah,
always.
It's nonstop. So, and I don't have a gimbal or anything for my phone, so I apologize for the shakiness. Probably won't bother to stabilize the camera in post. Anyways, so what I was wondering about is what do you think the theme for Seattle Study Club at this event is? The future of dentistry and predicting or changing the future of dentistry. So Dad, what do you think, what is the future of dentistry to you look like? You know, what do you think? That's my question.
Well, one of the things that was really stressed was it's important to have.
You don't have to walk so close too. You'll be better framed if you're back a bit.
Further back?
Yeah.
Will I look bigger?
No.
No, I'm smaller.
There you go.
Okay.
Yeah, answer the question. I'll hold the camera.
The future of dentistry is still, part of it is, the key is relationships. That's what sets dentistry apart from a lot of the service industries.
Yeah.
And that's still something that's going to be important today and in the future.
Sure.
The things that always change is they're always pushing the envelope with techniques to do things, because that's what dentists do. I mean, we teach,
right,
but we also do. And
okay.
The materials come out, some look really sexy and you think, I've got to have that. But does it really make a difference for the patient? And
so the future are the relationships.
That's always the center. I think that futures, they're making restorative materials that they can print.
Yeah,
that's pretty amazing.
Yeah. So printing, but at the core of that is like finding out the patient's why.
Right.
I mean, we talk about that a lot. Finding out the patient's why, maintaining the relationships, building the relationships. That's kind of what I think you're saying.
Yeah. Yeah.
And then leveraging the technology to take care of the patients with that. Right.
Yeah.
Okay. So follow-up question. How do you determine, because you've been doing this, I got to switch arms. So we're going to switch sides here. Come over here. So, how do you determine whether or not a product or a service is something that people should invest in, or, whether it's money or time?
Okay.
Like, cause I'm 15 years out and we're hanging out with some dentists that are less experienced and some dentists that are more experienced, although there aren't a lot more experienced than you. But so what advice do you have for people that,
how to analyze something?
Yeah. And we'll just stop right here, 'cause there's some people at the beach.
There are 3 things. One, and this was a metric that a really famous dentist, Gordon Christensen, always used. Is it better? Is it faster? Is it save somebody money? If it saves the dentist money, you can pass it on.
Yeah.
And so we've looked at products that we think we get really excited about, some of them.
Sure.
And then we realize that it doesn't
It doesn't
do it
check all
better.
those boxes.
Right. Yeah. And so
Yeah.
that's a real kind of foundational way of just looking at it.
Yeah. Well, let's turn around. We'll walk this way.
Okay.
So, and if the noise is a problem with the wind, I apologize, but we have these mics, so we'll see. Actually, we'll go up here and then we'll turn around again. But the concept of checking all those boxes, I've told, working at Hill Country Clinic for 13 years and then getting to mentor new dentists, I've told a lot of dentists, we'll turn around again. So, I've told a lot of dentists, hey, if a company is telling you, if they lead with it's going to save you money and make you more money, then don't buy their service or listen to them. Now, maybe that's like part of it, but really that shouldn't be the leading point. The leading point should be quality and also, checking all three of those boxes if you can. Sometimes you can only check 2 of those boxes, but I think, okay, so those are my 2 questions. And some other summary for the day is we started the day with a special forces operator from Scotland. That was cool. He told us some crazy stories, and it was like he was describing movies or video games, but it was his actual life. Yeah. So that was really neat. It was the shrapnel in his leg that he was describing that sets off the airport detectors now. Yeah. So that was pretty incredible. And he talked about teamwork and leadership and setting a good example and investing in your people. Those are all principles that we try to pursue. And then there are a bunch of other lectures, kind of follow-ups to ones from yesterday. So the format for day 3 are more breakout sessions, and we get to deep dive. Yeah, deep dive. So Dad got to deep dive with the toothware lecture, which we mentioned yesterday, and then I did a deep dive on 3D printing and that technology. So yeah, I think day number 3 has been great. There's an event this evening. We're gonna finish up by doing a little exercise on the beach, a little walking, talking, and answering questions, and we'll check in again later. We got Dapper Dad here. Yep. And Young Buck Grasshopper Chris. Signing off. Okay. We'll catch you later. Bye, everybody.